I'm Colin Hung with Healthcare IT Today, and I'm here at the Collision Conference, and I'm sitting down with Philippe Marcotte, CEO of Lotus Medical. You're doing something very unique in the Canadian healthcare market. Tell me what that is.
Yeah, we are. Thanks. So essentially, we're building tech-enabled primary care clinics across Canada. So Canada is a very unique market in terms of healthcare. Most clinics are owned and operated by doctors. They still function in, the old school method of, you know how they are. And we're just coming in and bringing in, scale, centralization, automation, technology to really create, a much smoother and more 21st century experience across all of primary care.
Can you talk to me a little bit about some of the technologies that you're implementing or that have implemented in your clinics?
Yep. Yeah. So the biggest piece of technology we have, we call it the Lotus operating system, Lotus OS for short. It's essentially a digital twin of the clinic. So a digital twin is a digital representation of something physical. So it brings online something that's offline, such as a process or a service or something like that. And we use sensors, we use technology applications to generate data that allows us to model a little bit what's going on the ground floor, and then we can monitor what's going on, we can control what's going on, we can predict what's going on, and then we can adapt. So it just makes the entire experience much more, modern.
So let's talk about some of the specifics though in terms of technology. Are you using like remote patient monitoring type stuff? Are you doing self-check-in? What kind of stuff is in the clinics?
Yeah, so we don't use remote patient monitoring yet. It's not something it's something that we have looked at when we were more in COVID. But now it's the end-to-end experience is all digital. So self-check-in, absolutely. We have the entire digital experience that's automated. We have a lot of the admin tasks that we use robotic process automation. We have the entire scheduling system that's in-house, and then we partner with a lot of other providers so that we can have an end-to-end experience that's fully digital. So for example, the EMRs, for example, the billing, like everything automated, completely paperless.
It sounds very much like the direct primary care movement that's happening in the US and companies like One Medical and so forth. Is that kind of where you're going with things?
Yeah, it's actually, it's a little bit what made us create the company. Is we've seen what was going on in the US with the One Medical, with the Carbon Health, the Forward, the Parsleys, all of these guys, making these huge businesses in a typically much more old school industry. And then, in Canada, in the public sector, we had none of that. And that's why there is a huge opportunity for us to come in.
Do you feel that the time is right for this kind of approach in Canada? Because let's be honest, a lot of us as patients are used to the old school, takes me 3 months to get an appointment, nothing's electronic kind of approach.
Yeah.
Are Canadians ready for this approach?
Absolutely. I think on both sides of the fence, in terms of doctors, in terms of patients, everyone's ready. I always take my wife, who's a pediatrician, who's the medical director of one of our flagship clinics. She's 35. She uses Uber, she uses Amazon, she uses, all the technology, and then she used to go to the hospital and have her pager and then, have everything. She would go back 30 years. And most of the doctors are exactly in her situation, and they're absolutely ready to, have technology. As long as it's well done and the change management is done properly, they're thrilled by it. And on the patient side, even my 79-year-old dad doesn't want to call a clinic anymore and spend 30 minutes. Like he self-checks in. He takes his own appointments. He's fine. Like with the pandemic, he's done Zoom. He's done all these things. So they are absolutely ready.
It's good to hear, because obviously we hear a lot right now about physicians and how they're really not very happy with the EHRs that they're using, and everything around it is very, it's a lot of work. They're working late into the evening. Is that sort of part of some of the things you're addressing with the clinic approach that you're taking?
It's a huge, huge part of what we're doing. One of the main objectives that we have is to tackle doctor burnout. So pre-pandemic, we had studies from Stanford, I think, that was saying that 48% of primary care physicians were going to burn out at some point in the period. And now with the pandemic, it's even worse. And EHRs and all these tools, a lot of the times they're not built for the user, they're not built for the physician, they're built more for documentation purposes, for regulatory purposes, and so they generate a ton of work that the doctors need to do, and that's where we come in. First of all, for us, our customer is the doctor, and then the patient is our customer's customer. So patient experience is super important, but our key experience for us is the doctor's experience. And then it's building tools that are intuitive, that are easy to use for them to actually unload their work. And then we also use humans, for example, nurses or staffs, administrative staff, to do the tasks that a doctor shouldn't be doing. Like if you're going into any other industry, someone who makes the salary of a doctor is going to be, let's say a senior vice president of something. You would not expect the senior vice president to be the one handling dozens of faxes every day. Like they would have someone on their team doing this. Yet in medical, this is what we ask of them, and that's why they're working late into the night, because they have to see their patients and then they have to go home and do all of this. And this is essentially what we're doing, either with tech or with people.
So you have a couple of clinics now in Quebec. What's next for Lotus Medical? Are you going to be expanding across Canada? What's the plan?
Yeah, that's the goal. So we're VC backed, and the idea is to really create one of the major banners of primary care across Canada. The market is absolutely ready for this. It's a highly fragmented market, and having a couple of banners, including Lotus, as companies that are very focused on experience, both for the patient and the doctor, is going to be super game-changing for the industry.
Well, what's got you excited when you look at the technology in healthcare? Is there any particular technology that's got you really excited?
There's a lot of technology that gets me excited. To me, it's a little bit where we're going with scale. So I talked a little bit about the Lotus OS and how it allows us to see exactly what's going on in the clinic. So we can see which patient is going where, which practitioner is going where in real time, and see what kind of care is being done, what kind of wait times the patients have. And this allows us to really understand what's going on the operational level for a clinic. Now, bring this with scale, and you start seeing where the patient is going across facilities, and then continue with scale, and then you start having a macro view of what healthcare services are. And then when you combine it with other data sources that you have access to, such as appointment data, medical billing data, EMR data, you start having an insane tool that is so powerful that it just might have the force to push the behemoth of healthcare into the 21st century. And for us, this is the main mission, because primary care, total healthcare in the public system, free and accessible for all of Canadians, is a huge point of pride for us. For me personally, for all of the people at Lotus. And so finding a way to make it sustainable, to make it efficient enough so that the government can sustain it over time, is why we get up in the morning.
Excellent. Well, thank you so much for all the information you shared. It's been really great to have you on the program.
Thank you for having me.
This has been Colin Hung with Healthcare IT Today. Thanks for watching.